Dr. Saikat Patra, Associate Professor in the Department of Neonatology at Himalayan Institute of Medical Sciences, Joligrant, Dehradun. And today we are going to discuss about thermoregulation in a neonate. Why worry about thermoregulation in neonate? Because body temperature is a primary vital sign in the newborn. In adults or in pediatrics, we talk about ABCD or CABD, but in newborn there is always a T which comes before ABC, and the T stands for temperature. This is followed by airway, breathing and circulation. Hence, thermoregulation is topmost priority in the clinical care of a newborn baby. What is the goal of thermoregulation? It is to maintain the correct body temperature range, to maximize the metabolic efficiency, to reduce the oxygen use, to protect the enzyme function and to reduce the calorie expenditure. However, there are multiple challenges in thermoregulation of a newborn. Prior to the delivery, infants do not maintain their temperature independently. When the infant is in utero, the temperature is generally 0.5 degrees Celsius higher than the mother's temperature, and after delivery there is a rapid cooling which happens. So, the maintenance of the body temperature after delivery is a major task, as the skin is thin and blood vessels are close to the surface and the newborn baby has very little subcutaneous fat to serve as barrier to the heat loss. The term infants have 3 times the surface of the body mass of an adult, and the preterm infants and the SGA infants have their 4 times the surface mass to body mass of an adult. So, the newborn baby, term or preterm, they rapidly lose heat after birth, and this is a challenging thing and must be taken care of at the time of birth. Preterm infants are also susceptible to heat loss due to poor tone, decreased fat content and thinner skin than the term infants. There is the concept of neutral thermal temperature and the neutral thermal environment, which must be clear to us before we proceed further in discussion about how to maintain the temperature in the newborn. First, neutral thermal temperature. It is the body temperature. I repeat, this is the body temperature of the newborn at which an individual's oxygen use and energy expenditure are minimized. This will lead to minimal metabolic rate and minimal oxygen consumption in the newborn. Whereas the neutral thermal environment is the air temperature. I repeat, this is the air temperature surrounding the baby, and this supports the maintenance of a neutral thermal body temperature. There are various mechanisms by which a newborn loses heat. The 4 major mechanisms are conduction, convection, radiation and evaporation. A brief about these 4 mechanisms. Evaporation, this occurs soon after birth due to evaporation of the amniotic fluid from the skin surface. Conduction, heat loss happens due to contact with the cold objects like cloth, tray or any other object. Convective heat loss happens due to air currents in which the cold air replaces the warm air around the baby. This usually happens if there are open windows or fans in the area where the newborn is there. And radiation heat loss happens to colder solid objects in the vicinity, usually the walls if they are cold. The process of heat gain in the newborn is also by conduction, convection and radiation in addition to non-shivering thermogenesis. So, again this picture shows the various ways in which the heat loss is happening in a newborn. The first picture shows conduction, the second one shows the cold air leading to convection, the third one is the evaporation and the fourth one is the radiation heat loss to the surrounding. There are various risk factors which leads to poor thermoregulation in the newborn, and they are prematurity, small for gestational age, endocrine problems, cardiac or respiratory problems, large open areas in the skin and sedated infants. Now, in one of the previous slide, I have discussed that the process of gaining heat in a newborn is non-shivering thermogenesis. Let us discuss briefly about this mechanism. This occurs due to metabolism of the brown adipose tissue which is present in the newborn baby. This process is initiated in the hypothalamus, where the sympathetic nervous system will start to act and norepinephrine will be released at the site of brown fat in a newborn. What is this brown fat? This is a energy source for infants. This is usually found, as can be seen in the picture over here, near the kidneys, around the adrenal gland, in the neck, in the mediastinum, in the scapular area and in the axillary area, and it cannot be replaced once utilized. In full term infants, the brown fat is 4 to 10% of the adipose deposit. In preterm infants, the brown fat will not be found until 26 to 30 weeks of gestation. Thereafter, only small amount is visible. Brown fat disappears by 3 to 6 months after birth, except in cold stressed infants where it will disappear sooner. And hypoxia, if present at the time of birth, will impair the brown fat metabolism. Coming to hypothermia per se. Hypothermia, how it is classified? Well, the newborn's temperature, as can be seen over here, a normal temperature is between 36.5 degrees Celsius to 37.5 degrees Celsius, and our aim should be to adequately maintain this range of temperature. If the newborn's temperature lies anywhere between 36 degrees Celsius to 36.4 degrees Celsius, this condition is known as cold stress, and we should always protect the newborns against this. If it is not picked up at this stage, the newborn will further move to moderate hypothermia, where the temperature can lie anywhere between 32 degrees Celsius to 35.9 degrees Celsius. This is a danger zone for the newborn, and the baby needs to be warmed up rapidly if the temperature lies anywhere in this range. The third severe most hypothermia range is the severe hypothermia, where the baby's temperature is below 32 degrees Celsius. The outcome will be grave in such situations, and urgent skilled care will be required if any such body temperature is found in a newborn. After understanding the classification of hypothermia, let us now know what are the consequences of neonatal hypothermia. This will lead hypoxemia from the increased oxygen consumption. Hypoglycemia can occur due to increased glucose metabolism. Respiratory and metabolic acidosis will develop secondary to the anaerobic metabolism, and there will be inhibition of the surfactant production because of the increasing acidosis in the newborn. Hypothermia usually can present with the following signs and symptoms. The body will appear cool to touch. There will be mottling or pallor in the newborn. Central cyanosis or acrocyanosis may be visible. There will be poor feeding demonstrated in the baby, along with abdominal distension and associated hypotonia or hypoglycemia. The gastric residues will increase, leading to vomiting. There will be bradycardia, tachypnea, shallow respirations or apnea, and the baby will ultimately become lethargic. To prevent all this, we need to keep the baby warm, and there is something known as warm chain which must be maintained right from birth. This is a set of 10 interlinked procedures which is carried out at birth and later, which will minimize the likelihood of hypothermia in all newborns. These are the following 10 points of warm chain. Warm delivery room must be maintained. A warm resuscitation using warm gases, immediately drying the newborn baby, skin to skin contact between the baby and the mother known as breast crawl, breastfeeding initiation as early as possible, bathing and weighing the newborn must be postponed, appropriate clothing and bedding of the newborn, rooming in or bedding in of the mother and the baby, warm transportation from the delivery area to the area where the mother is staying along with the baby, and training or awareness raising of the healthcare providers will ultimately lead to better thermoregulation in the newborn. How do we prevent hypothermia at birth? Conduct the delivery in a warm room. Immediately dry the baby in pre-warmed sterile towel, and a second pre-warmed towel should wrap the baby. After drying, you should discard the first towel and then wrap the baby in the second pre-warmed towel. Ensure that the head is well covered. Keep the baby by the side of the mother, and mother's temperature will keep the baby warm. This is known as skin to skin contact and should be practiced in all deliveries wherever possible. Warm resuscitation is a must. Heated humidified gas must be present in the delivery area. Kangaroo mother care is started immediately after birth in all low birth weight babies who are stable. This picture shows the various strategies used for prevention of hypothermia at birth. The left one shows how to clean the baby with the towel. The dry towel will, another second dry towel should wrap the baby, and the head must be covered because the maximum heat loss happens from the head of a newborn. After that, the temperature recording is the second most important step. Human touch can record the baby's temperature with reasonable precision, but we need to record it with much more diligence. Hence, abdominal temperature or the skin temperature is required. The abdominal temperature is representative of the core temperature. Warm pink feet of the baby indicates that the baby is in thermal comfort. When the feet is cold and abdomen is warm, this means that the baby is in cold stress, whereas if both the feet and abdomen are cold, then the baby is in moderate to severe hypothermia. So, the various strategies of measuring the temperature are skin temperature, where the probe of the thermistor is attached to the skin over the upper abdomen, and the thermistor will sense the skin temperature and displays it on the panel. Another way of temperature recording is the rectal temperature. This is best guide for the core temperature in cold sick neonates. The thermometer is placed backwards and downwards to a depth of 3 cm in a term baby or 2 cm in a preterm baby and kept for 2 minutes. Rectal temperature is not recorded as a standard procedure in the newborns. Axillary temperature is as good as rectal and probably safer because there is a less risk of injury or infection. The bulb of the thermometer here is placed against the roof of the dry axilla, which is free from moisture. Here the temperature is recorded after 3 minutes. If the baby is detected to have hypothermia, then how do we manage them? First, confirm the diagnosis of hypothermia by correctly recording the temperature using a thermometer. Then, if the diagnosis is confirmed, rewarm as quickly as possible. The various methods utilized to rewarm the newborn baby are skin to skin contact, a warm room or bed, a radiant warmer or an incubator. Infection is suspected if despite taking above measures the hypothermia persists. Hypothermia management using a radiant warmer. Well, the radiant warmer is set at 37 degrees Celsius in the manual mode or air heated incubator with a air temperature of 35 to 36 degrees Celsius. If the baby was in severe or moderate hypothermia, then rapidly rewarm the baby to 34 degrees Celsius and then slowly rewarm to 36.5 degrees Celsius. Monitor the heart rate, blood pressure, temperature and glucose every 15 to 30 minutes during this rewarming phase. Other supportive management with oxygen, IV fluids must be continued as and when necessary. The other extreme spectrum of problematic thermoregulation is hyperthermia or fever. This is when the temperature is above 37.5 degrees Celsius, and this is usually a sign of infection in term neonates. In all the febrile neonates, a diligent search for a possible infective focus must be made. It should also be kept in mind that in summer months hyperthermia may occur due to raised environment temperature. This is usually treated by moving the baby into colder environment and using loose light clothes for the baby. This point must be kept in mind to prevent the use of unnecessary investigations, and if the baby still persists to be hyperthermic after doing these steps, then a diligent search for the possible infective foci must be done. Temperature, if recorded, is between 37.5 to 39 degrees Celsius, then undressing and exposing the neonate to room temperature is usually all that is necessary. However, if the temperature is above 39 degrees Celsius, the neonate should be undressed and sponged with tepid water at approximately 35 degrees Celsius, the water temperature, until the temperature is below 38 degrees Celsius. Monitor the temperature every hourly. This is the supportive management of fever. Then we need to find out the focus of the infection and treat accordingly. So, this brings us to the end of this presentation. The important points to remember is the normal temperature range, what is hypothermia, the types of hypothermia, the signs and symptoms and its management, as well as the signs and symptoms and management of hypothermia in a newborn. Thank you.